Talo palava, bula vinaka, malolelei, kamna Māori, kupela morning, halo o keta, eka maui omo, bon dia, and warm Pacific greetings to you all. My name is Sarai and I have been part of the Bundaberg Palm Health Program. And in our Pacific way, when people share their stories with us, it is important that we return, acknowledge their contribution and share what happened next. So this message is for you, our palm workers who gave your time, knowledge and insights. We want you to know that your voices were heard and you have not been forgotten. So we will be sharing back to you what has happened these past couple of months. From January to March 2026, we spoke with 245 people, including 180 palm workers. Through 9 Talanoa sessions, workers shared their experience of health, well-being, and living and working in the Bundaberg region. You told us that it can be difficult to understand the Australian health system, know where to go when you are sick, understand healthcare costs and health insurance, get to appointments because of work hours and transport, and find clear information during floods and emergencies. You also spoke about stress, loneliness, being away from family and the importance of culture, faith, sport and community connection. In April, palm workers, employers, community leaders, services and government representatives came together for a co-design workshop. Co-design means that the people affected by an issue help to develop the solutions. Together, 5 priorities emerged: health education, access to healthcare, disaster preparedness, social connection, and better coordination between services. From June to August, 5 local projects received funding to respond to these priorities. The Pacific Islands Council of Queensland delivered health education through the Bundaberg Palm Health and Wellbeing Day, which connected workers with health information, local services, and practical support. Moana Impact Studio developed a local health service guide and disaster preparedness information, specifically for workers. Lindy Cannon held bilingual workshops so palm workers could continue sharing their lived experiences on the topic of women's safety. The Queensland Police Service developed key tags with QR codes linking workers to health and emergency information. Neutrano developed an on-farm gym and chapel to support exercise, faith, connection and well-being. These projects came from the needs and ideas shared by workers and the wider Bundaberg community. We also want to be honest. This short program could not solve every issue that was raised. Some concerns need more time and continued action from government, employers, health services and community organisations. But your stories created evidence, they help turn Talanoa into action and can guide future programs, funding and change. Now we would like to ask you, did these projects respond to what you shared? What was helpful? What still needs to change? Please scan the QR code on the screen to share your feedback. The questions are short and should only take a few minutes. To every worker who participated, we say thank you. Thank you for your time, your knowledge and your contribution. This work began with your voices and your voices should continue to guide what happens next. Paftai te le lava, minaka vakalevu, malo au pito, thank you Tumas, obrigado Barak, and thank you.